So joining us now, Dr. Stephen Stogner with Hattiesburg Clinic, Vice Chair of the Mississippi Medical Association Board of Trustees. Good afternoon there, Dr. Stogner. Thanks for joining us.
Good afternoon. It's my pleasure.
Yes, sir. So wanted to have you on. It's my understanding you're a pulmonary and a critical care specialist. Is that correct?
Yes, sir. It is.
So you've got lots of firsthand experience in fighting this COVID situation. Wanted to get an update from you on how that's looking in your area down there in the Pine Belt across the state, and what we're seeing with respect to the vaccination efforts.
Yeah. Well, for lack of a better term, we have been pummeled down here. The dramatic rise in the number of cases since July has just been horrible. We have had basically an overload of severely ill COVID patients requiring hospitalization as well as intensive care unit management for worsening of their already severe disease. We have, over the past few days, seen somewhat of a downturn, and we hope that continues. This, of course, is all essentially Delta variant strains that everyone has heard of. But we have seen a little downturn in the last few days. We're pleased with that. Vaccination efforts continue to be high priority. And while I don't know the exact percentage in our area, but we have seen an increase in the number of people that are willing to get the vaccination, and hopefully we'll continue to see a downturn in the number of these severe cases.
So one of the questions that comes up, I hear a lot, Doctor, is folks are skeptical about how, in fact, an infection is determined to be the Delta variant. Is there a test specifically for that is conducted?
Yes, there is. When this first, in other words, when the Delta variant first started showing itself, we actually would send off special tests that it would identify that particular strain of the coronavirus. It became, and they continue to monitor that, the state health department, which strains are doing what. But we no longer test for that specific variant because the numbers that we were seeing were essentially all due to the Delta variant, that is, of the latest surge. So
I see.
There is a test for it. We don't have to test it anymore until we start seeing, and from the state health department, that there are other strains that are causing some clinical problems.
I got you. And so you also indicated earlier in our conversation that you're seeing a rise in the rate of vaccinations. Is there anything you attribute that to kind of quell some of this vaccine hesitancy?
Yeah, it's probably multifactorial. One of the main reasons, I think, especially around healthcare workers and those that know healthcare workers, is the actual severity of disease that we have seen coming into the hospital due to the Delta. We have seen a number of people who were reluctant before to get the vaccination to now get it when they see some of these unusual presentations of basically a younger crowd of people getting severe disease, pregnant ladies, and even to the pediatric levels, some with severe disease that you don't expect. So that certainly played a role. Certainly public education on the matter. In other words, what the vaccine can actually do is certainly not 100%. There's certainly some natural immunity that if you've had the COVID vaccination before, that debate still goes on as to whether or not you need a vaccination after you've had the COVID infection, or whether or not, in other words, boosting you with the vaccination after a COVID infection, in other words, is going to be something that's highly recommended. But it's a number of factors, but just the severity of disease and the education to the public about what the vaccinations have actually accomplished in this pandemic.
Yeah. Well, there's still, we have lots of listeners here that are still hesitant. And one of the things that comes up that folks say is, well, the survival rate is pretty high and the mortality low. And so I don't really need to get vaccinated for something that's likely not to kill me.
Absolutely. And I understand that. The overall mortality of the COVID-19 infection does have a low mortality. However, the infection rate, the number of people that get the disease, when you start seeing that in the thousands and thousands and thousands of people, even with a death rate less than 2%, let's say 1.7%, all of us probably know someone who has developed severe disease, and if they did survive, many of them have the complications of having had the infection. So absolutely, the chances are you will overcome it. However, there are particular categories of people that we know have a very high risk for developing severe disease, including increased risk of mortality. And as I stated, when you're seeing that in the thousands and thousands of people, that's still a lot of people being placed in the hospitals on mechanical ventilators and so on. So absolutely, it is a situation on a personal basis that, I'll take my chances, but I'm vaccinated, and if they'll offer another booster, I'll get it too, because this is observation. I don't have to look at data, although I do. I don't have to look at published data. I've seen it right here before my eyes, what this virus can do. And certainly the mortality rate is low, but when you're seeing these numbers of people, it's too many. So what it can do and what the vaccination can do that we have observed is certainly falls in the favor of becoming vaccinated, unless there's a reason that you can't get vaccinated.
Yeah, and beyond just mortality, also there's the issue of so-called long COVID and enduring health conditions. And I think all of us know somebody that has been infected and still has some sort of lingering conditions.
It is, and that's continuing to be followed. A lot of physicians are seeing patients that have had the COVID infections weeks ago. I actually know a number of patients who are requiring oxygen, supplemental oxygen at home, and their infection was 6 weeks ago. Now, that is not the norm. That is not the norm. But this virus can damage the lungs as well as other organs. And although it's not common, I don't want to be one of the uncommon ones.
Yeah.
And so if it can reduce my chances of getting this virus and the potential complications that occur with the virus, then that's the roulette table that I'm going to play at. So absolutely, this long COVID, we'll continue to see that. In fact, I was just reading an article yesterday looking at some of the long-term damage to the lungs in these patients that develop severe disease, patients even that did not appear to develop severe disease, develop some scarring in the lungs. So that is a major concern. That is a major concern.
Doctor, appreciate you joining us today, and thanks so much for the valuable insight. We'll talk to you soon.
Thank you so much. I enjoyed it. Anytime.
Yes, sir. Dr. Stephen Stogner, Hattiesburg Clinic Vice Chair, Mississippi Medical Association Board of Trustees, has been our guest. We appreciate you joining us today. We got more middays coming up after this break.